Okay?
You want to
Okay. No. Nothing. Okay, so today our subject is to see how we can mix different techniques for pelvic floor rehabilitation. So the content of my presentation is the following. So we'll start with a very short reminder on pathologies. Then we'll talk about assessments, and we'll see the different techniques: stimulation, biofeedback, and postural control. And we'll finish by seeing how we can mix these different techniques. So, reminder, there are many different pelvic floor pathologies. Of course, they affect women and men. And the main pathologies we see are urinary incontinence, anorectal disorders, pain, and prolapses. We'll mainly focus on urinary incontinence, but with this device, you could treat all of them. There are various causes for these pathologies. The main pathology is muscle weaknesses. Your pelvic floor is often too weak. But at the opposite, we can have overactive muscles, like overactive bladder for urge incontinence. And you can also have tension in the pelvic muscles. And last point is a poor coordination, and that's very important because sometimes all your muscles are working correctly separately, but together they're not doing the right things. So another very important point is postpartum. It's not pathology, but after birth, it's a time when where there are many pathologies that could occur. So we have to, it's very important if it's possible to have rehabilitation after postpartum, with also abdominal and postural rehabilitation. It's the best way to avoid future incontinences because it's normal to have some leakage or incontinence just after birth, but it should disappear very fast. It's very important to note that after 3 months, everything should be okay. And if pathologies are remaining, they must be treated as fast as possible. So when we are starting our rehabilitation, the first thing and the most important thing is assessment. Because, as I told you, you can have very different reasons, causes for the problems. And if you're treating it the bad ways, it will be counterproductive. For example, if you have an overactive bladder on your pelvic floor is already correct, if you do some strengthening, it won't be effective at all. So, first part is assessment. So, you can use whatever form that you have. The important thing is that you must discuss with your patient and to understand exactly what could be the problem, because there can be many different, and your patient might not tell you everything at first time because she's shy, because it's intimate, because she doesn't know sometimes. She can feel problem, but she cannot understand how and when. And that's very important to prepare this, to do this assessment. So this is the chart that is embedded inside this device, but you can use also many different ones. So we can see the first point is lifestyle. You have to understand what is the kind of life your patient has. Does she do sport? Does she do things that could affect her pelvic floor? What is her medical history? What is urogynecological history? And obstetrical history, of course. How many children did she have? Were there some problems during birth, forceps, peridural, episiotomy, or whatever? Because knowing this, you can have a first idea of what could be the problems. Of course, you have to talk with her and understand the reason of her consultation, because if she comes, she might have a problem, and she has to describe it as precisely as possible to help you find the good techniques for her. And last point, very important point, is the manual examination. So if I just switch here and go here. So here, it is a device here that can help you with different techniques. First point here, we have some patient files where we collect all the data for this patient. First thing we do here, we select a kind of assessment we don't want to do. So here it's just, it was a trial this morning, but okay, so that's the form you saw. So first page is mainly history. On second page, you explain your symptoms. What are the different problems you could have? On last page is a clinical examination. This part is also very important because that's where you will start to have objective information concerning this patient. The first page it's subjective because it's what your patient says. It's important, but it must be completed by an objective part. Okay, so that's for assessment. So you saw this patient file that's inside the device. It's important because once you did the assessment, you will do a lot of things with your patient. And this patient file will keep track of all you're doing with your patient. You'll get a track of all the assessments, but also all the exercise you're doing with your patient. That's really important because in pelvic floor rehabilitation, progress are very slow. And you have to keep track of them to show your patients that she's getting better, because many patients think it's flat, it's always the same, I'm not doing better. And if they're not confident in their rehabilitation, they will not succeed. So keeping track of everything is the best way to show your patients that, no, it's not always the same. Now she can do this, before she could only do this. And that's a key point for good rehabilitation. Yes, no. Okay, so this patient file will help you keep track of things and keep track of progress. Last point is with this patient file, you can send it to the doctor who prescribes the rehabilitation. That's very important to show him how you work, and in order that he sends many other patients to you. Okay, another point is once you did the assessment, you have to talk with your patient because she has to be an actor of a rehabilitation. She cannot come and just wait that you're doing magics. It will not work. She has to understand in order to do it correctly. So there are many things in this device that you can show to your patient, anatomical charts, good posture, food to eat, what to eat and what not to eat in case of anal incontinency, for example. There are many, and you can use whatever fit to your patient to explain her what is her problem, what she can do, and how it can get better. Do not hesitate to talk a lot with your patient. Give important rules, explain. The most important is about hygiene, because we are in an intimate area, so we have to take care of hygiene. So give rules to your patient, explain what she can do, what she cannot, what is okay, what is not okay. And also give many advice on day-to-day life, because especially after when it's the first time your patient comes to your place, she doesn't know what's good, what's not good, because it's not a subject that we're talking about with friends or whatever. So you're the person who can give some good advices. So do not hesitate to give as many as possible. And most important, you have to get feedback from your patient. She must talk. If she's not telling you anything, you won't be able to do the good rehabilitation and make sure it's okay. So we did a good assessment now, and we can start working. And first thing is to have a really objective assessment, because up to now we were discussing. So you use manual assessment, but manual, sometimes it's difficult to estimate if the muscle is weak or very weak or medium weak. So here we'll use the device to make this assessment. Okay, so I'll show you directly here. So here I'm using this probe. It's a Bluetooth probe, but it would work. Usually we're using this kind of probe, you know, vaginal probes. This one is can do stimulation on biofeedback. This Bluetooth probe, you see there's no electrode on it, so you can only do some pressure biofeedback. And it would work the same with anal probes or whatever probes. So here, yes, it's okay. I'm connected, you see here. Does this work? The other way. Okay, you can see here, it says I'm connected to my probe, so now I can start to work with my patient. So first thing we'll do is an objective assessment. So you can see it's very easy. It will take 1 minute. So we'll start with, we'll test 4 different things. The first one is, does the fast fibers are working correctly? The second one, slow fibers. The third one, is the reflex present? And the last one, can the patient lock her contraction and move? So that's what we'll do. So when we start, sorry, mistake. I didn't select a good peripheral. When we start, we will ask our patient to test a fast fiber twitch. So we'll ask her to contract and relax, contract and relax, contract and relax again, as many times as she can, you see. So often it's getting lower and lower and nothing. That's what you often see. The important thing is how many real contractions she could do. So here we can see we did 6. So that's quite good for a start. Second thing, we'll ask our patient to keep a contraction half of the maximum intensity we reach the first time, as long as we can. So that's the black line here. I have to stay above the black line as long as I can. So I ask my patient to contract. And here again, here. So there's an holding time here. And we see here, my patient managed to hold her contraction 18 seconds. That's good also. Next thing, I will ask my patient to cough. That's what you should see. When coughing, you should have an automatic contraction, a reflex contraction. And last point, I will ask my patient to contract and to move, and to hold things heavy, or I can, if she's on the table, I can move her legs or whatever, and make sure she's able to maintain. If you see something like that, it means that at some point, she lost her contraction, and that's the point when you take something heavy and you get a leakage. Okay. So with this, now you see very fast, we've done an assessment, and we can see what's working correctly and what's not. So here, fast fiber twitch are okay, fast twitch fiber, sorry, are okay, slow fiber also, reflex is okay, but here we have a problem with locking at effort. So we know we have to work on this part. It could be whatever else, or worst case, nothing moves, you just have line everywhere. Okay? So knowing this, you can do your diagnostic and guess what you will do and what you will work on with your patient. Okay. And as I explained you, I can get it back here in my patient file. I get back my assessment on previous assessments and compare them. You see? So here I can see that, sorry, yes, that fast fiber were okay and they're still okay. And here, slow fiber were pretty good, but now they're very good. That's important because with this kind of chart, you can show very easily to your patient that she's getting better. And also, if she doesn't like charts, you have the numbers. So here, you can have, for example, the number of fast contractions she did. And it's very easy to see improvements. Yes? Okay. Okay, so that's for the assessment. Now we can work. First technique, very well known, is electrostimulation. That's the most used technique, it's evidence-based. There are many literature on the subject, so no question. it can work. It works on many pathologies. Why it is very often used? Because there are some very cheap devices like those one who can do it very easily. It's very easy to set up. You just have to insert the probe and start the program and put the intensity on. It's low risk because we're using a specific kind of current that is non-dangerous. You cannot burn or whatever. So it's efficient. For example, on muscle weaknesses, you will get back some strength on the pelvic floor. So that's why it's very used. One very important point, it can be scary for some people, to have some current sent to an internal probe. So you have to talk a lot with your patients so that she's confident with this technique. And one important point is that it must not be painful. More important, if it's painful, it's not more efficient. So it's no need to tell. If you see that your patient wants to do the best, to have the best rehabilitation and go up with his intensity, she will feel pain. You must lower as fast as possible because it will not be efficient. Okay, so this technique works very well, but it has very important drawbacks. It's not very efficient on the long term. The strength you win with electrostimulation, you will lose it within a few months. So it means doing some again and again and again and again. Because, mainly before, the patient is not an actor. And sometimes you can have some ladies going to rehabilitation on having good results, but do not understand at all what is their pelvic floor. And that's not what we want, because that's not how it will be efficient on the long term. So with BioStim, it works nearly the same as with small devices, with some specific thing. So yes, just before going there. Within this device, you can have different currents, because depending on the currents, you have different effects. Okay, so we have most classical is muscle straightening. So usually it's about 50 Hz, but it can be a little less if you want to work more on slow twitch fibers, sorry. A little more if you want to work on fast fibers, but usually this intensity is recommended because it treats everything. That's why we are using it a lot. The second one is relaxation. This can be used for bladder overactivity. With this current, you can relax the bladder. It can also be used for overactive pelvic floor, if you have vaginism or things like that. And the last one is tense current. Tense, there are two kinds. Endorphinic currents that are efficient several hours, even 7 days. On gate controls, which is very efficient, but on a very small time. As soon as you stop the electrostimulation, the pain can remain, can come again. But it can be very useful, for example, after episiotomy. If your patient has a lot of pain, it's not necessary to start exercise with her at the first session. First, you must treat pain. So you must help her to feel better. And we'll see after for incontinency and so on. So you can start a first session just with gate control. So she'll feel relaxed, and that's already quite a good point. And we'll see later for other exercises. Another very important point is the intensity. As you can see, we are not using the same intensity depending on the kind of exercise we want to do. When we work on muscle straightening, of course, we need to have a contraction. So we'll adjust the current to have a really good contraction. Whereas when you're doing some relaxation, you don't want a real contraction. You just want that the muscle beats. So you must see that it's moving, but just because that's what will relax the muscle. And last point, when you're doing tense currents, you don't need, it's counterproductive to have a contraction. You just need to feel the current, because with this kind of current, you don't work on muscles, but on nerves. So you must not activate the muscles, you must just be effective nerves. That's why you must just have a tingling feeling, just going through. That's when these currents are effective. So with this device, as you can see, it's quite easy. You just have to select this part, see all the programs, and depending on the pathology you found during the assessment, you select. Most common one is stress incontinence. Here, you select, and you just have to start, and your session is good. So that's very easy. The interest on this device, as opposite to small devices, is that you directly have the pathologies, and you can select the pathologies, and then work. So yes, there are many pathologies, but usually it's always 2 or 3 that you're using. Also, you can adjust everything here. You see, I've chosen even sensitive. Let's say I chose sensitive because my patient doesn't like current at all, and she's very bothered by current. So I choose a specific sensitive current. The difference here is that I have a specific parameter, the pulse width, that is smaller. So the electricity is, we cannot feel it, but the pulse is shorter, and it's better when you're sensitive. But if my patient is really sensitive, I can even lower it a little. So I can adjust everything. That's one point that is often adjusted depending on your patient. And also at the opposite, if your patient doesn't feel anything, you can increase pulse width here. The other point that is very important is work time and rest time. You should have a rest time at least 2 times the work time. Because if you're not doing this, you will have a contraction, a continuous contraction, and it's very tiring for your muscles. And in the evening, when your patient goes back home, she will have leakage, and that's the opposite, even if she didn't have before. So that's obviously not what you want. So never forget to keep an important rest time. And also, that's when you need feedback from your patient. If your patient tells you that she's got a problem when coming back home after the session, you must increase this for next session. So for example, here I could go up to, let's say 18. 18 is enough. 18, and this way, I'm sure that this patient will be treated correctly. So it's very easy to start, but you have full control on what you need. And that's what is very important. If I did this adjustment for my patient, next time she comes, I will get back from her patient file. I will find the session I did. I will restart, for example, up here, stress incontinence, here, stress incontinence. I will restart from here, and I will just get back all the parameters that I adjusted for her. That's for stimulation. Any question? Do not hesitate to ask questions, because sometimes I might not be clear for everybody. Okay. So that was the first technique. The second technique should be the one you use the most because it's the most efficient. It's biofeedback. Biofeedback's principle is here. So your patient tries to contract a muscle here at pelvic floor. The device records this, shows this to a screen, and it's going back to the patient, and he can see if he succeeds, if she succeeds or not. And this turning around makes things work better and better and better. Here again, it's an evidence-based practice. There are many documents. And one important point is that it can work. There are some home-used device, but some studies shows that we have best results if you are guided by a physiotherapist, because when you're doing things alone, sometimes you could have bad postural adjustment, bad parasite contraction, and so on, and you cannot see it if you're alone. That's why it's much better to work with a therapist. And of course, it requires a very reliable, precise, and ergonomic device. Because how it works, when you I'll show you on my arm. When I contract my arm here, I have a small current from between the two extremities of my muscles. But as you can guess, it's very small because nobody gets hurt by touching me when I contract my muscles. So it's about a few microvolts. So that's really nearly zero. So you need a very precise device that can amplify this signal. I'll show it back to the screen. Okay, so I'll show you how it works here. It's a little like the same we had just a minute ago with stimulation, but here, now it's the patient to work. So first exercise you have to do with your patient is to make sure she understands how to contract her muscle. So we'll start here. Again, I'm testing with this one, but it would work the same with classical probes, just easier. So you ask your patient to contract and relax. If you're lucky, you see this. Very often you're not lucky because your patient, when you start, you'll see something like this. Okay, so that's nothing. You just see this line. So you have to find some ways to explain your patient. So you can explain many different ways. Here, if with the curves she doesn't understand, you can try some other animation kind. So this one is often very used. Okay, you see, and here now my patient must put it up, contract, and it's going up. It's very simple, but often it works quite well because it's easier to understand this kind of level than curves that moving. Another one that works even better is this one. So here again, you will ask your patient to contract and relax. When she's relaxed, it's open. And here, you see, when I contract, I close. So it's the easiest for women who doesn't understand curves. Usually when, with this kind of graphics, okay, I understand, okay, close, 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 close. And she managed to contract the pelvic floor. That's the point we're looking for. Once it works, you can have both kind of design on the same screen, and then she can see what's going on and how she will see it for other exercise, because we'll need this kind of visualization for the other exercise. Because now my patient contracts correctly, I can start an exercise. Let's say she has problem with slow twist fibers. I will select this program. You see, we have here different shapes. So here we see a plateau. So that's for slow fibers. Here it's very specific to fast fibers, only peaks. And we have many more difficult if your patient's getting better. But usually we start with this one. And at the end, we can have a mix of everything. So if we start, we'll see how it works again. So I'm choosing whatever animation. Okay, okay, sorry. So I'm choosing this animation, and now, okay, we start. Now my patient has to catch some objects, whatever. The goal of this kind of exercise is to make it less boring, because the session lasts about 20 minutes, and 20 minutes of squeezing and relaxing can be quite boring. So you have to find a way for your patient to keep motivation. So using animations, using different exercises, whatever you can find is good for her. And so here you see, I'm not very good, but whatever. And an important point is that you see, the low level is very important. It's not good if your patients stay contracted all the time. A good rehabilitation needs to be able to contract and to relax. If you only contract, it's not good. That's why we really need, this rest time is very important, and it must be done correctly. Okay. So I can show you everything, but there are many different animations in order that you can change every time with your patient. I told you that rest time is important. Sometimes you have overactive patients, so you have to work with them. Here, of course, you don't need some exercise with telling her to contract more, because what you need is to contract less. So here, we have a specific exercise here. Okay, here it is. You see, it's an exercise. We start, I don't do it. Okay, we start with, okay, we start with our patient with very contracted. You see that the blue line is already very high, and we want her to go down, down. And we have this kind of visualization. Now we ask her up and up, up and up and up. Again, it's another visualization. There are many. Every patient needs something specific, so you have to find the good animation for every patient. The interest of having this kind of device with many different animations, many different things, is that you can find the perfect fit for every patient. Okay, and here that's one that works also quite well for relaxation. Okay, and last point concerning, no, not last point. Here was also one point I didn't mention. Okay, sorry. Up, up, up. Okay, one point I didn't mention is that after some time it can become difficult for your patient to do the exercise because she's tired, because whatever. Because after 10 or 15 minutes she can get tired. So you can adjust everything. Here you see on the top, here we have some specific adjustment parameters. I can decrease, you see, decrease the size to make it easier. Or sometimes during the first session we can increase, because when the patient starts to understand, she's getting better. So you can adjust, and also you can adjust work time, because you see here sometimes it becomes too long. She cannot, after 10 minutes, she cannot get it. So we are making it smaller. Again, it's very important to adjust everything, because if your patient succeeds, she will continue and she will have some results. If she thinks she's failing, she will stop and going back home with her problems, and that's not what you want. Okay, so here it's okay. Once you're doing this, also another important point, but I won't be able to show it easily, or maybe. Okay, now the other very important point is that sometimes when you ask your patient to contract, she contracts her pelvic floor, no problem, but she also contracts abdominals, she contracts glutes, she contracts legs, she contracts whatever is in this region. And you only need to contract pelvic floor. So you can use, that's why we have, on this device, we have 2 different channels. In fact, we have 4, but let's say we have 2 for the moment. We have 2 because we can use one for vaginal probe, and the other one you can put on the abdominals. This way, it will do, I'm cheating a little bit, not too much. This way, we can do something like this. Okay. Just checking, yes, okay. Okay, now I work with my patient, and I can see her pelvic floor on the top, and if I have connected my electrodes on my abdominals, I can see the abdominals here. So when she's contracting her pelvic floor, if I see this, it means she's also contracting her abdominals, and that's not good. So I can tell her, no, stop. You can tell her to put her on and feel if she's contracting, and make sure that she's not doing this kind of things, and by some time she will contract only her pelvic floor without abdominal, or without any parasite contraction, and that's what you want, you see. So that's the interest of having 2 different channels on this device. Because just, okay, so, Okay, because abdominal muscles are very important for continency, but it's quite difficult to use them correctly. In fact, you have rectus, obliques, sorry, and behind you have transverse. Rectus and obliques are very bad for continency because when you contract them, you add pressure inside on your pelvic floor that can cause incontinency. That's why when you have your patient, you should tell them not to contract because by default, when contracting abdominals, you contract rectus and obliques. If you have worked with her on a breathing exercise and so on, and you're sure she can contract her transversus, that's good because the transversus is very good for stability and also for continence when he's working the right way with the pelvic floor. But it's very difficult to be sure of this. There's only one device, here you can see, one device who can already do some biofeedback on pelvic floor, on transversus, but usually it's nearly impossible. So if you don't have this device, it's better to tell your patient not to contract anything because the risk is she might work in the bad direction. Okay. So that's good, but I told you at the beginning that sometimes you have some patients with flat curve. When you ask contraction, nothing. You ask again, nothing. Again, nothing. So that's usually that the girl doesn't know what is her pelvic floor and how to feel it. So here we have combined programs. Again, there's some literature on the subject. Combined programs, it's a mix of stimulation and biofeedback. Let me show you how it works. Here. I will tell my patient that she will start with stimulation, as we already saw, and then just after, she'll do some biofeedback. You can see here, it is bold, it is stimulation. Here, it is thin, it is biofeedback, and we'll do it again and again and again. The interest is that with stimulation, she can feel which part of the body is contracted, and after she can try to do the same by herself. If we start, okay. So here, it's not, no, I cheated a little, but usually imagine we've got a flat line here. So when we start, here you see the red line. During the red line, we have stimulation. Okay, so that's first part. So she has felt something. And then we ask our patient, please try to contract the same muscle that has been activated by the device. First time, nothing. Maybe just a little glitch. Nearly nothing, let's say. So again, we'll do a stimulation. Here, she can feel the muscle. So maybe closing your eyes, you can feel it a little better. Okay, now my turn to play. And time by time, we feel which muscle we have to contract. And here, we'll see, okay, it's a little better. Not perfect, but better. Oh no, yes, that was not so bad. But after 3, 4, or 5 turns, there will be a connection between how to contract this very specific muscle, and it will work. So that's a very good interest of this for a good proprioception. Combined programs can also be used in another context. If you have a patient that during the session get tired very fast. So we've seen that we can make the exercise easier, but we can do better with this. Here, we can ask an assisted biofeedback. So when I start, again, So my patient now controls pelvic floor perfectly, but she's getting tired very fast. So here, let's imagine first time, beginning of the session, it's okay, we can see she's following the path very well, good relaxation, everything's good, nothing to say. But after, let's say 5, 10 or more minutes, when she has to contract, she starts with a good, but she's too tired and relax. Okay, on here, you see, the stimulation takes the lead, and we can have a good combination of both. This way, she's doing the best she can, and she's helped by the device.
ده حاجه من الحاجات مثلا بتاعنا بتفرق عن اي تاني ان البيشنت اثناء التريننج بيقدر يعمل تريننج لو البيشنت حصل له فتيج او وقع في النص بيقدر يعمل له السيستم ويكمل الاستيموليشن بنفس الريت. فدي ميزه موجوده عندنا مختلفه عن اي جهاز ممكن يكون موجود. الجهاز ده من اقوى الجهازين على مستوى العالم.
Thank you. Sorry, my Arabic is not very good. Next time. So once we've seen two different techniques, stimulation, biofeedback, and how to combine both to be even more efficient. Another very often used techniques that doesn't require anything is postural control. So you can do some Pilates exercise, you can do some breathing exercises, and that's very important because it's good for your stability, and stability is good also for continency. When observing this, we've discovered that there is a specific reflex that is called anticipatory postural activity. It's been demonstrated by Hodges in 2009, and this anticipatory postural activity is the fact that before moving, a few milliseconds before, your pelvic floor will contract automatically. It's just a reflex. So if I want to hold my baby in a coffin, when I start holding it, just before, I have an automatic contraction and I can take it without leakage. So this is very important reflex to work on. This require, sorry, I don't have all the devices I would like to have today, but this requires this kind of device. So you see, just a small device that I will stick on my balance board. Let's say Bosu or whatever plate you can use for working with movement. So my patient is on my balance board, this device also. And with this, I can track the movement of my patient. So let's do it again. So again, it's working in Bluetooth, so I have to connect it. Okay, so now we are connected. So as you can see, okay, I have my balance board. So when I'm moving in a way or the other, I can capture the movement. If I were on it, I'm not on it, but if I were on my platform, I could see the movement of my patient on my platform. This way, I can have, yes.
استاذنا احنا في اي سؤال احنا محتاجين نساله او نعمل كلاريفيكيشن اي حاجه فمستر سباستيان المفروض ان احنا نساله
ساعات الصوت ما بيبقاش واضح في
هو بص هو هنساوي شويه على شويه انجليزي فممكن بس لو في اي حاجه مش واضحه ممكن نساله دايركت وهو يقدر يساعدنا. يعني انا حاسس ان الناس بدات تتناقش في البايو موف. البايو موف هو طبيعي لما بنبدا نتحرك او البيشنت يتحرك بيحصل كلوجر للبلفيك فلور. الجهاز عندنا بيقيس الكلوجر ده قد ايه ولو حابب اعمل له تريننج هقدر اعمل له تريننج. فهو بيتكلم على هذه القصه ان ده بيتحط على بيبقى فيه بالانس بورد. اي بالانس بورد حتى لو موجود الخشب العادي بنحط عليه البايب مون وده وايرلس فاجينال بروب. ده بيبدا يتحط بالنسبه للفاجينا ويبدا البيشنت يشتغل. هيطلع لنا القرايات هو هيوري قرايات الحركه مع البريشر مع البريشر ويبدا يعمل اسسمنت او يعمل لنا بايو فيدباك. وبعد التريننج برضه يقدر يدينا البايو فيدباك. تمام؟ لو النقطه دي كده واضحه اوكي لو حابين نتكلم عنها اكتر اوكي. Thank you.
So once we've got this, we can work here on, you see here I will have my pelvic floor contraction and on my other track I can see if I'm moving, when I'm moving on my balance board, when I'm moving this line moves. When I'm contracting, this one moves. So if I see some movement here, I should see a contraction before. If I don't see it, it's that my reflex is broken. So I have to work on my reflex. So it's very easy to do. You just have to tell your patient to contract, move, relax. Contract, move, relax. And here you can see that before the movement you have a contraction. Of course, because she's doing it willingly, but by repeating this kind of contract, move, relax, contract, move, relax, after time it will become a reflex. And then you can work with your patient on a very specific and difficult exercise. Yes? The red was the movement. When moving, you see the red going up. When standing, the red is down. Let me show you again. Okay. Imagine this is on my plate here. So every time it moves, you see, when it moves, the red line is going up. When
during the activities, yeah?
Yes, during the activities. At the same time, you see the blue line. The blue line is vaginal probe. And when I move, the red line goes up. Yes?
So the contraction of pelvic floor, which one?
Blue.
The blue. Yeah.
Blue.
And
فوق بتاع الكونتراكشن بالظبط هو بيشوف ساعه الحركه
الجرافيك بالظبط الجرافيك اللي بيجمع كده عمليه اناليسيز للموفمنت مع الفاجينال كونتراكشن او بيلفيك فلو كلوجر.
excuse me.
Yes.
Then what you mean? You mean wait. You mean when you do like that? I know which movement make contraction.
As soon as, in fact, when you're on a plate,
Yeah.
every movement you are not. It's.
So if I want to increase the weak muscles or hyperactive muscle, I use of the direction of.
That's, in fact, you use this kind of thing when you already did the first part of rehabilitation, having correct muscles. But if your muscles are strong enough, now you can work in coordination to make sure they are activated at the good moment. But you cannot start with the weak muscles. If you start this, it will not work.
It's become okay by physiotherapy.
Yes.
And I can use it in the gym to
Yes.
build more strength.
Yes, exactly. Okay, so here we can do it willingly. Okay, I see, I contract, I move, I release, until the reflex come back. Once the reflex we think is back, we can test it on something more difficult. Sorry, again. Because now I don't see anymore my contraction. I can hide my contraction totally. Okay, now my patient just is on a platform and she has to move to get the point. You see? I move, I get the point. I move, I get the point. Moving to get the point. So this is to make sure that the reflex is back, because you see, after, you can check. You don't see the contraction during the exercise, but you can see it afterwards. And then I see here the dashed line. And when I move here, I moved without contraction, so that's bad. But here I moved, and we can see that just before I had a contraction with the blue line. Here again, I moved just before I had this contraction. And that's how you can make sure that you have the reflex that is back correctly. And this reflex is the core of a good continence. That's it. Okay, I think that's it. So that was to show you that you can use many different techniques. They are all very interesting. Biofeedback, of course, is the most important one because it lasts on the long term. Because, for example, if your patient starting to, yes, I forgot something. If your patient starts to lose continence, if she has done biofeedback correctly, she will know what to do at home to make some squeezing exercise and so on to get it back correctly. Whereas if you use stimulation, she's lost, she has to come back to you. So there are many different techniques. And combining them is the key, because in real life, you're not just lying on a bed waiting, you're working, you're taking things, and that's mixing that during your rehabilitation that making it like day-to-day life. So that's what you should do. And to do it correctly, you need a device that can mix all these techniques. One thing I didn't talk to you about is anal incontinency. So let me show you this point. So when you have, sorry. Yes. So we mainly all we did was for classical incontinency, vaginal, but it can also be with anal probes for men. For example, after prostatectomy, it's exactly the same. It works exactly the same, but with this kind of probe, which are thinner and dedicated for men. So, but you can also have some anorectal problems. And for those anorectal problems, usually the problem is between the pressure that you put inside your abdomen, on your rectum, the pressure on your rectum, and the work on the sphincter. So we'll use this kind of double balloon probes. These probes will be inserted inside the rectum, like this, and you'll keep just the small balloon on the sphincter. This balloon will be inside the rectum. And you can then monitor what are the pressure inside the rectum and work on this sphincter. So we'll use anorectal, just like we did with vaginal probe. We'll start with an assessment. And here we have a specific assessment. So I'll do it fast, but so yes, too good. So I'll do it fast first. I'm cheating a little. Okay. Okay. Now you can see here. Imagine my probe has been inserted correctly. Here is my rectum inside. Here is my sphincter. You see, I can work on my sphincter. We can check here that my fast fiber twitch are working correctly. So that's important. Exactly the same than we did.
What is the red line?
The red line is your intra-abdominal pressure. You see? The pressure inside the rectum.
ده بندخله فده بيبقى عند السفنكتر بتاعت الانس وده بيتنفخ مع طريقه السرنج ده بيخش في الريكتم فده السفنكتر اللي هو الريد والبلو فور ريكتم. Right?
Yes, but in fact when doing the rehabilitation, first thing we test the sphincter, and after we'll test what's going inside. So for this part the red was not useful for the moment. So second exercise is the same also we did with pelvic floor, is to maintain contraction as long as possible. Here we just test the efficiency of the sphincter, nothing else. And after, yes?
Then are inner muscles, so you so the external sphincter.
Yes, external sphincter, yes. And this one is inside the rectum.
Inside the rectum, there is the parasympathetic, so just feels the pressure.
Yes, exactly. But we'll do something else because, yes, that's okay. Because, let's take it the other way. So imagine I'm like it. Okay. I'm like this, so my probe is correctly inserted. And now I want to test if I have a good reflex, because when your rectum is filling, you should have a reflex like this, you know, of contraction, automatic contraction. So I will fake my rectum filling with this syringe, and I will inflate a little my rectum balloon. Okay, you see? And now you can see that when I had an increase of pressure in the rectum, I had an automatic reflex. So that's good. So here I can see how many millimeters I had to put to get back the reflex. you see. And after, I will go further, inflate, 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 even more than this, and measure the total rectal volume. Because the two main pathologies when you have anorectal problems is that either you lost the reflex or your rectum is too small or too big. For every case, you have a specific treatment. If your rectum is too small, you will every week work with your patient and inflate a little more to force the rectum to get bigger. It's for, usually it's the opposite when you go to the stool too often, you know, and after some time, your rectum, since you're emptying it all the time, it's getting very small, and then you have, it's getting worse and worse because the more you go, the more your rectum gets small. So for this, every week you start, for example, let's imagine the rectum was 30 milliliter. First week, you'll put 40, weeks after 50, and then 60. And every week, you will increase a little the volume of the rectum. Yes?
How do I know if the rectum is small or big?
You'll know it because with this, you'll inflate it as much as possible, and you will ask your patient when he cannot stand it anymore. And that's the moment where you have the total volume. And you will see if it's small or big. Usually it should be around 2,000 milliliter. 200. And if the problem is with the reflex, again, you can work on this kind of chart. So you have, in blue, you have your sphincter, and you will tell your patient, when you see the red line, contract. Sorry, I just didn't take it the right way. I'll do it again. Here, it will be easier. Here. Okay. Okay, so if my patient has a, I should have disconnected this board. Okay, if my patient has a problem with reflex, has no reflex, I will work with him the same than with the balance. I will tell him, sorry, it's really not corrected. I did too fast. Okay, I will tell him, when you see the red line going up, sorry, which one is which one? Yes, it's the opposite. Yes, it's always this way. So the sphincter is the red line, and the abdominal pressure is the blue one. Okay? So you will tell your patient, when you see the blue line going up, contract. You see the blue line going up because you inflate, contract. And after some time, he will feel. At first, he's only doing it because he sees a blue line. But repeating it, it will get inside and it will feel the reflex, and the reflex will be automatic. But it's quite long. But with this probe, you can do this kind of rehabilitation also. Okay? Okay. Any question?
The last application is for the weakness?
No, it's not for weakness, it's for incontinency, anorectal disease. So anal incontinency or whatever happens in the anal problems, in fact, anorectal problems. It's not?
Is it normal to have pain, tolerant pain during the test?
Usually there is no pain at all. If there's pain, you stop, you treat the pain, and later on you can work. But if your patient is painful, she won't be, she won't listen what you tell, she will just think about her pain, and it won't be efficient. So if you feel that your patient has pain, first you find a way to stop the pain. and after you can work. But you can't work if you have pain. And it's not painful. So you have to do it correctly, use lubricating gel and so on to avoid discomfort, but there's no pain.
Okay, you try to pick the abdominal contraction during the
Yes.
kind of protocol. It's by surface electrodes,
Yes, surface electrodes, exactly.
but this is pressure electrodes during the inside the vagina and inside the.
No, usually you use this kind. I just for the show I just use a pressure electrode because it's easier to show on my end. But usually you use this kind, and this is EMG electrode. The advantage of EMG is that you can do biofeedback and stimulation. With pressure electrode you can do stimulation, and it's often interesting to mix the techniques. That's why this one is the best.
This picks the electricity from the muscle.
This one is for
Picks the electricity from the muscle. It's like the EMG. Which
yes, that's EMG. That's yes, EMG and stimulation both. It's just like surface electrode but inside, just the same.
But the other one, the rectum picks the pressure.
This one, only pressure, yes, and only anorectal.
When you use the balance board for what?
In fact, you use balance board if you're doing your rehabilitation and you feel that your patient has good muscles, because it's a start. You cannot use balance board. Yes, it's once the muscles is not anymore weak, once you have strengthened it correctly, you have to work on coordination, and that's when you use it. So it's really at the end of the rehabilitation. Because you need everything, you need that she's able to contract correctly, long time, peak time, whatever. And after you can work, stand up and do some exercise. That's the end. And when this is correct, you've done a good job.
For mixed urinary incontinence?
Yeah.
Or constipation?
Everything. Because when you have, it depends, but usually when you have a good posture, everything gets better. You see? So it's mainly for stress incontinence, but for everything. Any questions? Thank you.
ثانك يو مستر. لو حد حابب اي استفسار او كلاريفيكيشن حاجه معينه احنا ممكن مع حضراتكم. هو بس في حاجه، هو البروب ده مش فاجينال، ده انال، ده بيستخدم للميل، نفس الفانكشن بتاعت الفاجينال بتاعت الفيميل يورينري انكونتيننس بنستخدم ده للميل، او يعني عشان طبعا الناس بتستفسر على الارتباط. اي بروب فيكي تاني ده اي جي، وفي نفس الوقت بيستخدم للباستون او الستيميوليشن. تمام؟ ده للبريشر، للانر بريشر. البروب ده وايرلس، ده بيستخدم في الغالب مع البايو موف تكنيك، وده وايرلس بيستخدم فاجينال للبريشر. تمام؟ فدي الديفرنت بروب الموجوده. في طبعا السيرفيس اللي موجود معانا ده بنستخدمه احيانا في بعض الكيسز يعني او في دواء عشاء.
الحاجات دي بتبقى سيلف يوز، مش كده واحد بس اللي بيستخدم.
بص، هو الصح اللي احنا كشركه مرتبطين بيه وهنقوله ان كل ده سنجل يوز. ده يشتغل في حاله من خلال الكاندم والكاندم والمضادين ويقدر يشتغل بيه. ده عن طريق برضه الكاندم نقدر نشتغل بيه حالات كتير، بس هو المفروض الفاجينال هو الوان بيشنت سنجل يوز.
اعتقد ده غالي قوي.
مش عارف اقول لك ان انا سعري تقريبا ارخص من السعودي. سعري تقريبا ارخص من السعودي. بالنسبه للبروب ده تقريبا ارخص من السعودي. تمام؟ فالبروب ده بيستخدم فور وان بيشنت. في ناس بيستخدمهم الفاجينال ووش كديسانفكتنت، بيستخدموه. انا ما اقدرش اقول الكلام ده، بس الكلام هو موجود. البروب فور وان بيشنت. لو في اي استفسار او اي كلاريفيكيشن طبعا نسمع من حضراتكم.
طيب لو انا استخدمته كاي ام جي، ايه الانفورميشن اللي انا اعرفها منه؟
الانفورميشن هشوف الديجري بتاعت الويكنس اللي عند البيشنت ايه، هقدر اعمل دايجنوز المشكله اللي موجوده عند البيشنت ايه، وايه البروجريس اللي بيحصل نتيجه التريتمنت اللي انا بعملها مع الفيجن.
انا قصدي يعني هيديني الامبليتيود هيديني هو بيعد الديوريشن هو مثلا عامل فيها كونتراكشن.
طبعا بيدي حاجه باي فيدباك.
في ايه بقى غير دول؟
دي
حاجه تانية غير دول غير الامبليتيود تايم اللي هو ممكن
بالنسبه للجهاز
يقيسه.
في طبعا تريننج، وفي بعد التريننج بيقيس لك البروجريس لاربع سيشن ورا بعض. يعني لو في 4 سيشن عملتهم فيجن بيقول لك البروجريس في كل حاجه. في كمان اسيستنت ستيموليشن، يعني انا ممكن اكون شغال مع البيشنت اسيستنت ستيموليشن، فالبيشنت اثناء التريتمنت ممكن يكون جاي واقع مني، فالجهاز يبدا يعمل اسسمنت علشان انكريز الافيشنت بتاع المصل. تمام؟
طيب انا بقدر استخدمه لحاجه ثانيه غير البلفيك فلور؟ يعني لو انا دلوقتي عندي، بما ان عندي الجهاز، اقدر بالكترودز ثانيه استخدمه للمصل، بقيه المصل؟
هو احنا ميد
عشان يخلي التكلفه بتاعته يعني
هو بالفلو
بس.
لو في اي سؤال ممكن نسمع من حضرتك. لو حضرتك حابه تبص على حاجه معينه ممكن بعد السيشن نبص على الجهاز والحاجات الجرابين، مش مشكله خالص نجرب سوفت وير كده. هنبدا لو في مكان معين فيه ولا هنزيد ممكن نجيب بس يعني اقلهم مع نفسك. ممكن نجيب الجهاز نشتغل.
طب مش هتدونا بروشورز للجهاز؟
ممكن حضرتك تخش على الويب بتاع الشركه عندنا وبعد كده كل الداتا بتاعتي. هو لو رقم لو في بورت اللي كتبته 011 1 740 07
07
07
ممكن تاني
0 حي 740 07 او ممكن لو الجروب بتاع الورك شوب حاجه موجوده على فيه اكتب بس رقم تليفون SMS وانا هبعت لك اللينك على طول بتاع الجروب، او ممكن عن طريق السكان سواء فيسبوك او الواتساب.
الرقم على الجروب
معاك موجوده معاك على تمام. لو حد حابب يسال على حاجه على الجهاز ممكن يجي يبص على اللابتوب اللي معاه ستار ماستر او ستار ماستر. في حد حابب